SAGE-718 is an investigational compound. It works by positive modulation at the NMDA receptor, and it's an oral medication. And we are studying SAGE-718 in a comprehensive set of clinical trials meant to answer the question, could treatment with SAGE-718 improve cognitive functioning in patients with Huntington's? But also, what does that improvement mean for those patients? And I can briefly walk you through the 3 different trials that are either already launched or will soon be launched for recruitment. The first is a well-powered placebo-controlled study, so parallel group design where patients will either be assigned to SAGE-718 or placebo over a course of 3 months. During that trial, we will measure things like safety, tolerability, and pharmacokinetics. But most importantly, we will also be looking to see whether an improvement in cognition is measurable between patients assigned to either drug or placebo. A second study, which is a bit more innovative, is trying to link changes in cognitive performance to changes in functioning. And so in this second study, patients again will have a chance to be either on drug or placebo, and we will look for the effects of treatment over the course of a month. But we're also looking to see if those improvements in cognition track with changes in what we think are proxy measures of everyday functioning. So some patients will have the opportunity to participate in a driving simulator. Some will have the opportunity to participate in a virtual reality assessment tool. And this may help us answer the question, if we are able to improve cognition in patients with Huntington's disease, what does that mean? If we are able to show that they can drive better, if they can solve everyday tasks better, that helps us to understand what these cognitive improvements mean in the everyday setting. And then the third trial is an open label extension study. Patients from both of these trials, the first 2 that I mentioned, will have the opportunity to continue to be assigned to open label study drug over a course of a longer period of time. This will give us a sense of long-term safety and tolerability of the agent, but it may also help us understand long-term efficacy because these longitudinal naturalistic follow-up studies that exist in Huntington's serve as very nice comparator arms to an open label study. And so we are working with some of those groups to understand how we can collect measurements that correlate or map onto what's already being collected in the field.